Hi, everyone. This is Allison Burkowski, and I am here today to talk to you about access to care and understanding a little bit more about health coverage, health insurance, and why you should care about it. Just to introduce myself, I have spent my career helping commercial, state, and federal payers improve their processes, implement technology, and I'm very passionate about this topic. I'm very passionate about getting people coverage, understanding, why it matters that people have healthcare coverage. And today, I hope to explain a little bit more about this very complex process, and hopefully, you'll be able to pick up some of my passion and understand why it's important for you as well. Before we get started, I want to start with a little bit of a personal story. So, um, so this is my daughter Amelia. In 2012, when I was going through leadership, I had a pregnancy complication and delivered Amelia 7 weeks early. And she's obviously doing great today, but that episode cost about $100,000. And I didn't end up having to pay for that out of my pocket. Fortunately, I have insurance through my employer and only ended up paying about $8,000. But it's not like that for everyone. And so I just wanted to put that in your mind, and I'll come back to this story in a little bit. So accessing healthcare, particularly accessing healthcare in the United States, can be complicated and very expensive. So the United States spent about $3.8 trillion in 2019 on healthcare, which is about 18% of our GDP, and comes down to about $11,500 per person. So who's paying for all of that? Well, we are. This chart shows the distribution of where that cost is coming from. The orange is government sources and the blue is individuals and private businesses. And so you can see that the percentage of what gets covered by government is growing. But really, even that is coming from us. So it's our tax dollars. So really, we are the ones collectively paying for all of this healthcare. And there are 6 primary ways that people get coverage, that people get their healthcare paid for. And so I'm going to walk through each one of those. The first one is probably the most familiar to many people going through leadership today, and that is commercial insurance. So I have always had insurance either through my parents' employer, through my own employer, and that's the way many people in the United States get their coverage. So there's 2 ways that people can get commercial insurance, either through their employer, through a group, or as an individual. And the way this works is that just like car insurance, other types of insurance, if you purchase insurance through the group, the insurance company is able to predict your costs and predict the costs, the healthcare costs of your group, and spread that cost across the whole group in terms of premium. So people who have pre-existing conditions, who are sicker or older, will pay less than they might have paid as an individual, and someone who's younger or healthier might pay a little bit more. Everybody in that group pays the same amount in premiums. Buying insurance as an individual, you don't have the benefit of being part of that group. Prior to 2012, prior to the Affordable Care Act, people were rated by insurance companies as an individual, and a lot of people had a lot of trouble getting insurance or had prohibitive costs if they had a pre-existing condition, because the insurance company was rating them for the cost that they thought that person would incur. With the Affordable Care Act, insurance companies are no longer allowed to charge people more for pre-existing conditions. And so the insurance companies have now kind of spread all of that anticipated cost across all of their individual market, meaning that individuals who have a pre-existing condition who buy insurance as an individual are probably paying a lot less than they would have paid before. And people who are younger, healthier, are probably paying a little bit more than they would have paid before to buy that insurance coverage. Wanted to talk a little bit about health insurance exchanges, or marketplaces as they're sometimes called. So with the Affordable Care Act, You may have seen Maryland Health Connection or healthcare.gov, and these are state-based health insurance exchanges, which are just an online marketplace that enable people to purchase health insurance. And there are most people hear about health insurance exchanges through the context of the Affordable Care Act and through healthcare.gov, but there are private exchanges as well. And the benefit of these exchanges is to allow someone to be able to shop for coverage and to have a subsidy applied. So for example, if someone were to shop for coverage on Maryland Health Connection, they would be able to apply to see if they are eligible for a subsidy from the federal government, and they would be able to apply that subsidy directly to the insurance product that they're purchasing through that marketplace. Privately, employers sometimes will send their employees to a health insurance marketplace. So my employer, for example, just offers me a couple of options that I have to pick from. But some employers would rather offer many, many options to their employees, and rather than have the prices have the employer's portion of that premium pre-baked in, they send their employees out, they can pick whatever plan they want on the marketplace, and then the employer pays a portion through that. And so it's a way to give people more choices. Next, I wanted to talk about Medicare. So Medicare is a program administered by the federal government that provides health insurance for people over 65, as well as people with certain disabilities, like end-stage renal disease, for example. And there are two main types of Medicare. There's what's called traditional Medicare, or sometimes it's called original Medicare, which is getting Medicare directly through the Center for Medicare and Medicaid Services. And then there's also Medicare Advantage, which is a way of purchasing a plan that administers your Medicare through a health insurance company. And that health insurance company can then wrap some services around what is reimbursed by Medicare to be able to provide you additional services to help that Medicare recipient be healthier or have access to different networks of doctors, et cetera. So people who are eligible for Medicare get to pick whether they want to enroll in original Medicare or a Medicare Advantage plan. Both of these options are not 100% free. So they cover a lot, but they don't cover things like long-term care, and there are copays. So some people don't realize that until they get to the point where they're applying for Medicare or start enrolling in Medicare. But there is an individual portion of responsibility for Medicare recipients. The next program that's a government program is Medicaid. So Medicaid is a program for low-income people. And Medicaid is administered by both the federal government and the states jointly. So each state has certain requirements that they must adhere to with their Medicaid program. And then each state also has a lot of flexibility on how they're going to administer their Medicaid program, who's eligible. So there are certain things that they must do, certain groups that they must have eligible, and then other things that are flexible. And a state can apply for a waiver to the federal government, even to change some of the things that are the required elements of the Medicaid program. And so different administrations, different White House administrations have different perspectives on how flexible they want to let states be in customizing and tailoring their Medicaid programs to their specific populations. So that's another way where how our policy really influences Medicaid. Another example of how policy has influenced Medicaid is that through the Affordable Care Act, it became an option for states to offer Medicaid to adults without children. So previously, low-income adults with children were eligible to apply for Medicaid, and children on their own were able to get Medicaid, but childless adults who were of working age and did not have disabilities were not eligible to apply for Medicaid. And with the Affordable Care Act, states were able to decide if they wanted to offer Medicaid to those populations. And Maryland is one of the states that does offer Medicaid as an option to low-income people who meet the income requirements who are childless adults. The last group I wanted to talk about are the uninsured. So what happens if you don't have coverage? You don't have Medicare or Medicaid, you don't have insurance through your employer or have purchased it on your own. How do you get your healthcare paid for? Well, you would have to pay those bills on your own. And people who don't have health insurance on average spend a lot less on their healthcare because they're paying 100% of those bills out of pocket. And so they spend less overall, but they tend to spend a much higher proportion of their total income on healthcare. And they're at much higher risk for very high medical bills or things like bankruptcy due to medical bills if they were to have a catastrophic medical event and need to find coverage for it. So if they did have an event like that and weren't able to pay, those costs sometimes get absorbed by the hospital or institution that cares for that patient. Sometimes there are government programs that then step in or philanthropic organizations, or that person just remains in debt. And so it's important to think about how these costs get distributed across all of us. So when we think about buying insurance and we think about people maybe who are younger and healthier are paying a little more so that people who are older or sicker can pay a little less. And we think about how can we get people who are uninsured covered so that those people, some of their costs can get redistributed across all of us in a way that they don't have to have that. They can pay their share through having insurance, but not have to have that crippling debt or defer those costs to government or provider institutions. So we really want to make sure that everybody has an opportunity to pay for their own healthcare in a way that's affordable. And so thinking about how can we as a society enable people to be able to afford coverage that works for them. So how many people are covered by each of these categories? Today, in the United States and in Maryland, the majority of people are covered by their employer, by a commercial group insurance plan that they purchase through their employer. And then there are other people who directly purchase insurance through one of our exchanges. And you can see here that Maryland has a slightly lower uninsured rate than the rest of the United States. And these numbers are from 2018, but it's continued to be in that trend. And Maryland continues to do fairly well as far as being able to provide coverage for the majority of our citizens. So back to my $100,000 baby. So I wanted to just talk about, all of these scenarios that I just covered and what would have happened if I had fallen into a different bucket than the one that I fall into today. So because I have insurance through my employer actually happens to be self-insured, meaning they cover the cost of the medical costs for all of their employees. I work for a large company. So I paid about $8,000. My employer paid the rest. If I had worked for a smaller company that was insured more traditionally through a commercial insurance company, I would have paid my portion. My employer would have paid a contribution towards my premiums, and the health insurance company would have paid for the rest. And you see I've got an asterisk here, and that's just a reminder that a health insurance company, as they incur all of these costs, the more people in their group who have accidents or $100,000 babies, the more they need to then next year spread those costs out across the people that are members of that group. So my employer, for example, if everybody at my company had very high healthcare costs, the next year, all of our rates would go up. And so looking again, if I was somebody who had bought individual insurance, my employer, I wouldn't, if I didn't buy it through an employer, my employer wouldn't have covered any portion of that. If I had bought it through health insurance exchange, I might have been able to get a subsidy from the government that could cover a portion. If I had Medicaid, it would have been covered through a government program. And if I was uninsured, I would have had to pay that $100,000 myself. And she's almost 9 years old. I'd probably still be working through it. So, so just thinking about, how, the cost is the same. The bill was gonna be $100,000 no matter what type of coverage I had. But how that gets paid for depends on how the options that I had available to me for how I could get healthcare coverage. So why should you care? Well, if you think back to the slide I showed toward the beginning, healthcare costs are continuing to rise. We're at, $3.8 trillion. Healthcare costs are continuing to go up, and we need to think as a society about ways that we can decrease the rate at which healthcare costs are expanding and lower healthcare costs as much as possible. Also, the division across those buckets is shifting. In recent years, more of the funding for healthcare has come from government sources, less from individuals or private industry. But across those buckets, that division of where the money is coming from and how healthcare is getting paid for is influenced by policy. And so all of us have a stake in healthcare policy and how it influences what our options are and how that money is distributed. Another important thing to think about is that the infrastructure in our healthcare system today, so health insurance companies, hospitals, pharmaceutical companies, are very interested stakeholders. They have infrastructure in place, they have systems in place that are very difficult to change. And so when we are thinking about how we can innovate and how we can be creative in the ways that we lower costs in healthcare, pay for healthcare differently, structure healthcare differently to make people healthier and to lower costs, it's very hard to change those systems that are in place. And our legislative bodies who are trying to creatively implement policy have to work with all of these industries that have a vested stake in potentially keeping things the way that they are. And so in order to do this, as I said, innovation is going to be required, and all of us as community leaders are going to need to step in and pay attention so that when these things come up and come up in our local governments and come up with our local businesses, we can be informed and have an opinion. So there's no easy solution. One of the things I love about working in healthcare is there are so many interesting problems to solve. There will never be an end of problems to solve about how to deliver and pay for healthcare in the United States. But as leaders, we can continue to engage in the discussion. So thank you all for listening to my presentation today. I know it's not always easy to sit and listen to a talk about health insurance. But I tried to go through it a little pretty quickly today. If you have any questions for me, please feel free to email me, and I will also see you at your class session day. And I'm very happy to answer any questions that you have then. Thanks so much.